For patients battling ER-positive, HER2-negative advanced breast cancer, the development of endocrine resistance can be a significant challenge. What if there was a targeted oral therapy specifically designed to overcome this resistance, offering a new path forward? Today, we explore Inluriyo, a groundbreaking treatment addressing this critical need. Inluriyo, known generically as Imlunestrant, is an oral selective estrogen receptor degrader, SERD. It is specifically approved for adults with ER-positive, HER2-negative, ESR1-mutated advanced or metastatic breast cancer. This treatment is for patients whose disease has progressed after at least one line of endocrine therapy. This innovative therapy targets a common mechanism of resistance to standard hormone treatments. It offers a crucial option for patients facing endocrine therapy-resistant breast cancer. Inluriyo represents a significant advancement in personalized cancer care. Before initiating Inluriyo, ESR1 mutation testing is a mandatory step. This biomarker-driven approach ensures the therapy is precisely matched to the patient's specific genetic profile. ESR1 mutations are a key driver of endocrine resistance. These mutations occur in approximately 20 to 40% of patients with hormone therapy-resistant breast cancer. Inluriyo is designed to directly counteract the effects of these mutations. This targeted strategy maximizes treatment efficacy for eligible patients. Inluriyo offers several compelling advantages for patients with ESR1-mutated breast cancer. It has demonstrated proven effectiveness specifically against this challenging mutation. This provides a vital alternative when other endocrine therapies have failed. Its oral administration offers significant convenience, allowing for once-daily dosing at home. This contrasts with injection-based treatments, improving patient quality of life. Inluriyo also provides an alternative to CDK4/6 inhibitors in certain patient populations. The efficacy of Inluriyo was rigorously evaluated in the EMBER-3 Phase 3 study, NCT 04975308. This pivotal trial demonstrated significant progression-free survival, PFS, benefits. Inluriyo showed a 38% reduction in the risk of progression or death compared to standard endocrine therapy. Patients receiving Inluriyo experienced superior progression-free survival. The median PFS was 5.5 months with Inluriyo versus 3.8 months with the comparator arm, fulvestrant/exemestane. The hazard ratio was 0.62, 95% CA, 0.46 to 0.82, with a p-value of 0.0008, underscoring its statistical significance. Inluriyo functions as an oral SERD, working through a precise mechanism of estrogen receptor degradation. Imlunestrant attaches to estrogen receptors are located on cancer cells. This binding initiates a process that leads to the breakdown and disappearance of these receptors. By degrading the estrogen receptors, Inluriyo effectively blocks estrogen growth signals to cancer cells. This action prevents cancer cell multiplication and growth. This mechanism is particularly effective in overcoming hormone therapy resistance caused by ESR1 mutations. Inluriyo should be taken exactly as prescribed by your healthcare provider. The recommended dosage for ER+, HER2-ESR1 mutated breast cancer is 400 mg once daily. It is crucial to take Inluriyo on an empty stomach, at least 2 hours before food or 1 hour after food. Tablets should be swallowed whole, do not chew, crush, or split them. Consistency is key, so take it at the same time each day. Never stop or change your dose without your provider's approval. If a dose is missed by 6 or more hours, or if vomiting occurs after taking Inluriyo, do not take another dose that day. Simply resume your normal schedule the following day. Dosage adjustments may be necessary for patients with moderate to severe liver impairment. Your healthcare provider will assess your liver function and determine the appropriate dosage. Always communicate any concerns or changes in your health status. This ensures your treatment remains safe and effective. Like all medications, Inluriyo can cause side effects. Common side effects include decreased hemoglobin, anemia, muscle and joint pain, and decreased white blood cell counts. Patients may also experience increased liver function tests, decreased calcium blood levels, and nausea. Other reported side effects include decreased platelet counts, constipation, abdominal pain, tiredness, diarrhea, and increased triglyceride and cholesterol blood levels. Your healthcare provider will closely monitor your blood levels before and during treatment. They may adjust your dosing if needed to manage these effects. Inluriyo carries a significant warning: it may cause harm to an unborn baby. For females with childbearing potential, a pregnancy test is required before starting treatment. Effective birth control must be used during treatment and for 1 week after the last dose. Males with female partners who can become pregnant must also use effective birth control during treatment and for 1 week after the last dose. Breastfeeding is not recommended during treatment and for 1 week after the last dose. Inluriyo may affect fertility in both males and females. Discuss any concerns with your provider. It is vital to inform your healthcare provider about all medicines you take, including prescription, over-the-counter drugs, vitamins, and herbal supplements. Certain medications can interact with Inluriyo, potentially affecting its efficacy or increasing side effects. Strong CYP3A inhibitors, such as ketoconazole or clarithromycin, should generally be avoided. If concomitant use cannot be avoided, your Inluriyo dosage may need to be decreased. Conversely, strong CYP3A inducers, like rifampin or St. John's wort, should also be avoided. If co-administration is necessary, an increase in your Inluriyo dosage might be required. Always keep an updated list of your medications for your healthcare team. Store Inluriyo at room temperature, specifically between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Proper storage helps maintain the medication's stability and effectiveness. Always keep Inluriyo and all other medicines out of the reach of children to prevent accidental ingestion. When disposing of unused Inluriyo, utilize a medicine take-back program if available in your area. If no such program exists, visit www.fda.gov/drug disposal for instructions on safe household disposal. Never flush Inluriyo down the toilet, as this can harm the environment. Patients often wonder about the timeline for Inluriyo's effects. Clinical trials demonstrated median progression-free survival of 5.5 months, but individual responses can vary. ESR1 mutations are found in 20 to 40% of metastatic breast cancer patients who have received prior endocrine therapy. Advanced breast cancer symptoms can include bone pain, shortness of breath, abdominal swelling, and persistent fatigue. Always consult your healthcare provider for proper evaluation of any symptoms. While Inluriyo has shown improved progression-free survival, the metastatic breast cancer prognosis varies significantly based on individual factors.